The topic for this video is blood vessels, and I'm going to relate that back to the last video when I ended on systolic and diastolic, or systole and diastole, and relate that back to systolic and diastolic pressure in your blood pressure. So we have what's called a closed circulatory system because the blood is contained at all times inside of either the heart or the blood vessels. In a lot of animals, they have what's called an open circulatory system, which is where you do have a heart or some kind of pumping mechanism, and you do have limited blood vessels, but there's a point where the blood will leave the blood vessels and just basically shower and soak all of the tissues in the blood and then get collected again. Blood vessels help to keep blood moving in one direction, like I said, always moving in one direction.
There are three main kinds of blood vessels: arteries, capillaries, and veins. Arteries are large blood vessels that carry blood from your heart to the rest of your body. This blood is rich in oxygen and nutrients. As arteries get farther away from the heart, they
Okay, then, I guess moving on. There are three types of blood vessels in your body. You have arteries, veins, and capillaries. Arteries are large and muscular, and they carry blood away from the heart. There are three layers to the walls of the arteries. You have an inner endothelial layer. Remember, thelial is part of the lining that I talked about, like epithelium, and endo meaning inside. So it's endothelial layer. The middle layer is smooth muscle. Again, the smooth muscle is involuntary, which means it's subconsciously controlled. You don't have to think about controlling those muscles, which is good because we would all die because there's so much to do in our body that involves involuntary muscle. And then the third layer is the outer connective tissue. These three layers give arteries strength, but they're highly, highly elastic. They're highly elastic because they are carrying blood away from the heart, which means they are under the most pressure. Because don't forget, just when the ventricles contract, I do actually want to go back to here. One thing that I want to draw your attention to, and it kind of relates to arteries and their thickness. I want you to look, this is the right side of the heart. This is the left side of the heart. And the atria, there's the right atrium, the left atrium's around the back behind the pulmonary trunk here. So you're looking at here's the left atrium versus the right atrium. I want you to look at the difference in the thickness of the wall of muscle between the right side and the left side. So keeping in mind, where is the blood being pumped to from the right ventricle? It's going to the lungs, and the heart is right between the lungs. So it doesn't have to go that far. The right ventricle doesn't have to pump that hard because it's not going that far. But the left ventricle, look at the thickness of the wall of the left ventricle. It's huge and thick, and that's all cardiac muscle. The reason for this is because the left ventricle has to pump with enough pressure, it has to pump hard enough so that the blood is leaving the heart with enough pressure to have it circulate through the entire body and back again. And don't forget, like when you're standing up, all that blood has to move against the force of gravity to go back to the heart. So the left side of the heart, the left ventricle, is hugely muscular, way more than the right side because it needs to pump with so much force. So relating that back to reality, back to arteries. Here we go. We'll get there eventually. So arteries have to have a really thick wall to withstand the pressure of the blood coming out of the heart. When you take your pulse, you can either do it in your wrist or you can do it in your neck. That pulsating that you're feeling are the stretching of the arteries. And the reason why this is probably the best place is because it's the closest to your heart. So the closer the blood vessels to your heart, the more pressure they're under and the more they're going to stretch. So speaking of stretching and being under a lot of pressure. Blood pressure is the force that blood applies to the walls of your blood vessels. It's always highest in the two main arteries coming out of the heart. That is the aorta and the pulmonary arteries. But the pulmonary arteries, again, are coming out of the right side of the heart, going to the lungs. So they're still not under the same pressure that the aorta is under. Blood pressure is measured in the artery of your arm, and I've got a video to show you how that works. Let's get on with it.
So after we take the heart rate, we move on to blood pressure. And so there's some equipment that you need to have prepared for this. This is the blood pressure cusp. And so this whole black Velcro thing is what you wrap around the patient's arm. And you have the pump right here, which you pump up to put air in here, and that's what gets it tight around their arm. And so before you begin, you got to make sure this is twisted all the way to the right, righty tighty, lefty loosey. So when you have it all the way to the right, that's how you close it off so that air actually pumps into here. Otherwise, you'll keep squeezing and nothing will be happening. The meter, so when you pump it up, you can gauge how much air you have in by how high the numbers are. And you listen for the pulses with the stethoscope. When you put it in your ears, make sure that these prongs are facing forward, not backwards. Even though that's what you think it should be, you face it forward. And double check to make sure it's on by twisting. You can twist this and tap on it. So you hear, right now it's not really making a noise in my ear, but when I twist it, then I can hear it. And so that's how you know if your stethoscope is on and working. Otherwise, you might be sitting there and be thinking this person has no pulse, when really your stethoscope is just turned off. And then you have the patient put their right arm up on the table, and we use the right arm just for consistency throughout all the tests. So what you're going to do is you're going to try to see if you can find a pulse on the brachial artery. It's usually towards the inside of the elbow, around here. And you kind of just take a little mental note of that. And you're going to wrap the cusp around their arm. Keep it snug, but not super tight. You just don't want it to have it loose and wobbling around. So you put these in, and put the head of the stethoscope right where you had that pulse. And double check to make sure this is all the way tight. And you're going to squeeze. And by doing this, you pump air into the cusp. So I'm going to pump it up again just so you can see in the camera what's going on. So we have it up to about 200, and then we slowly let some air out. And that's where I heard my first thump, and you can see the dial bouncing up and down. And the last thump I heard was at about 64. So I got about 118 over 64, because that's where I heard my first thump, heard more, watched the dial bounce up and down, and about 64, I didn't hear anything anymore. But essentially what you're looking for is when you release the air, you'll see the dial go, and you'll begin to hear thumps, usually around 120. That's just kind of an average. Some people might be a little higher, a lot of people are lower than that. And what you're hearing here is the first thump is their systolic pressure, so that's when the heart has contracted and that's their highest pressure. And you'll continue to hear light thumps, and the last thump you hear is the second number you record, and that's their diastolic pressure, and that's when the heart is relaxed and it's refilling with blood. A lot of times people are a little scared of because it's kind of the more challenging one, but with a little bit of practice, you guys will be stars.
Okay, so he explained how that works. So when you, like he said in the video, the first thump that he heard after pumping it up, and of course now a lot of this is digital, so the machine just reads it for you, but the principle behind it is that the first thump that he heard is systolic pressure, because that is when the heart pumps with enough force to overcome the pressure from the cuff. That's systolic pressure. That's the number that comes on the top. In a normal adult, it's actually, I think males and females should be the same. So it's around 120. Anything higher than 140 is not good. Okay, and then so that's the first thump that he hears, and then he continues to watch the needle go down. It was really cool that you could see the needle bobbing as the blood was pumping through. And when you hear your last thump, that indicates a steady flow of blood through the artery, and that's basically indicates diastolic pressure when the heart is at rest. And that's called diastolic pressure. In a normal adult, again, it's about between 70 and 80. Anything higher than 90 or even 100 is dangerous. So what happens when you have somebody that has chronic or long-lasting high blood pressure? That's called hypertension. It's also sometimes referred to as the silent killer, because there are literally no symptoms. I myself have experienced hypertension before, when my blood pressure is around like 150 over 110, and that's quite dangerous because it means that your heart is under stress, and that puts your blood vessels in danger, because they're really under a lot of pressure. It puts strains on the walls of the artery, and it could increase the chance that it will burst. Again, there's no external symptoms. There's no indication that you have hypertension. So it's important when you're older to have your blood pressure taken on a regular basis, because if it's too high for too long, like I said, it can cause long-lasting damage, permanent damage for your blood vessels. Okay, so that's okay. From the aorta, blood is going to travel through smaller and smaller arteries. As they branch out, they're going to become structures called arterioles. These are just basically small arteries. Arterioles are then also going to branch off and get smaller and smaller until you get to capillaries. The walls of a capillary are 1 cell thick. This is to ensure quick exchange of materials, both nutrients, oxygen, and waste products like urea and carbon dioxide. The network of capillaries is so extensive that all of your 100 trillion cells in your body, not one cell is more than 125 micrometers away from a capillary. So 0.125 millimeters, every single cell in your body is within 0.1 millimeters of a capillary. And like I said, it allows for quick exchange of materials. If you were to take out all of your blood vessels, all of your arteries, your veins, your capillaries, if you were to line them up end to end, they would extend for 96,000 kilometers. That goes around the Earth 2.5 times. All of that just in one body. So these are, I don't know if it might be real, actually, just showing you the extent of the blood vessel network in your body. And before, in a previous video, when I mentioned the sternum, your heart's behind the sternum, this is your sternum here, and your ribs are attached there. And there you see the heart here. It's kind of in the center, and it kind of lies a little bit to the left of the center of your chest. So if people have open heart surgery, that's when the doctor will use a sternal saw, something like that. They use a saw to cut through the sternum, and then they pry it open to get access to the heart. Sometimes they do what's called a thoracotomy, and that's when they go in through the side. They'll go in through, I think, the 4th or the 5th rib. They'll cut through there, and they'll access the heart that way, and they'll take what's called a rib spreader. It's basically this like mechanical thing that goes in there, and then it pulls the ribs apart so you can reach your hand in the side and get access to the heart that way. That's more likely to be used in an emergency room kind of situation where you need quick access to the heart, rather than going through the process of cutting the sternum open. Okay, so we go from big fat arteries coming out of the heart, we get smaller and smaller into arterioles, smaller and smaller, branching out into capillaries. Finally, you're going to have capillaries. After the exchange occurs, you're going to have capillaries start to merge to form larger vessels called venules. Venules are going to merge together then to form veins, and veins carry blood toward the heart, where arteries carry blood away from the heart. And again, the inferior vena cava is the largest vein that brings blood from your lower half of the body, which you see there in the bottom left corner of the diagram. And the superior vena cava is from the upper half of your body. I'm actually going to skip this. Maybe I'll upload it, but it's basically showing the structure of veins, that veins have valves, which I'd rather just talk about rather than this video becoming like, an hour and a half long. So the walls of the veins are made of the same three layers as arteries. You have the inner endothelial tissue, the smooth muscle, and then the outer connective tissue. But because veins are under less pressure than arteries, because they're carrying blood back to the heart, the walls are thinner and less muscular. Because the blood is under less pressure, the blood is going to have the opportunity to end up flowing backwards, especially if you think of your arms and your legs where gravity works. It would be really hard to get the blood to go back to the heart against gravity. So veins are the only blood vessels in your body that contain valves, again, preventing backflow. In this case, you can see from the diagram here that the veins are located in such a way and arranged in such a way that they only open going up and they prevent blood from going back down. A lot of veins also, in addition to having valves, they pass through skeletal muscle, so that as your body moves around, the contraction of the skeletal muscle helps to push the blood through the veins. And this is a longitudinal section, which means you've cut long ways through a vein. So you're looking at, these are the walls of the vein here. And then here you see the cusps of the valve. So the blood flow will be in this direction. And then these valves will shut and it won't be able to come back the other way.